Hello friends, today I'll be discussing a case, a unique case that some of you might have seen before, but it has some unique findings where we are able to diagnose radiologically on plain films. So today's case will be totally on plain films. I'll be showing you the X-ray images and then I'll be discussing images with you. Okay. Now this is a case where we have an X-ray of a child who had come to us for skeletal survey, and I have two X-rays with me. In the first X-ray, which is the X-ray of the wrist with forearm, if you take a careful look at the forearm, do you see the findings? Now, I want you to look at the metacarpals number 2, 3, 4, 5. Now, please see, the metacarpals in the proximal part are tapering. Can you see that? These have been called as, classically they have been called as bullet-shaped metacarpals, which are tapering proximally. The carpal bones are not well formed. Now please see, the radius and the ulna are slanting towards each other. Okay, these are typical of some metabolic disease, which I'll come to that if you see it carefully. Now please see the vertebra. There is a kyphotic angulation to the spine, and if you see carefully, the vertebra, they show anterior central beaking. Now, so far with these findings, do you have a diagnosis in mind? Yes. The diagnosis is mucopolysaccharidosis. And which type do you think? Based on the imaging findings so far, we are sure we are dealing with a possible case of Mucopolysaccharidosis disease. Mucopolysaccharidosis disease, because in Mucopolysaccharidosis we have central beaking in the vertebral bodies. Sometimes you may have platyspondyly, or you may see kyphoscoliotic deformity, while in Hurler's syndrome, which is a differential diagnosis, the beaking is antero-inferior. Now let us see the other X-ray of the same child. Now look at the iliac wings. Iliac wings are flared, they are very wide, flared. While as I go towards the acetabulum, the iliac blades are showing a narrowing or constriction. Okay, so they are broader here and narrow here. This has been called as wine glass shaped iliac blades. This has been called as wine glass shaped iliac blades. The acetabuli appear large with irregular outline, and if I look at the X-ray of the knee, the metaphyses are splayed, they are broadened. Again, these are all typical findings of Mucopolysaccharidosis syndrome or mucopolysaccharidosis. So the case that we had today for your discussion with you was mucopolysaccharidosis, and it is possible to diagnose metabolic conditions on plain films. Thank you very much.